Welcome to the podcast interview with Dr. Kiran Peddi, renowned Consultant Medical Gastroenterologist from Yashoda Hospital, Hyderabad. Good morning, doctor.
Good morning, very good morning.
So, we have some questions to you for our readers.
Right.
Regarding the gastro issues what they are facing.
Right.
So, I want to ask you some questions to help them so that they can get some guidance from you.
Okay.
So, doctor, you are coming here in Kolkata every month.
Correct.
So, what kind of special medical issues you can spot here among the patients from Kolkata and West Bengal?
Right. Okay. So, quite often nowadays, what is happening is because of change in lifestyle or whatever, a lot of people are facing this gas issue. So, people are getting abdominal bloating, vomiting tendency, constipation, and then sometimes blood in the stool. Some kind of indigestion symptoms, more of indigestion symptoms. Most of them are innocent, but that will cause a lot of discomfort to patients and then make them uncomfortable. That will cause a lot of nuisance issues rather than any dangerous issues.
Okay. Doctor, do you think these kind of issues are related to lifestyle of the Bengalis or means patients from Kolkata, West Bengal, or any other issues, other reason?
What I observed is definitely lifestyle issues are there. For example, somebody not eating regularly on time, somebody eating very late and eating heavily at night time, eating more of oily food and irregular timings with the sleep irregularity and more of smoking, alcohol. All these factors will contribute to digestive issues. And apart from the bloating and other digestive issues, I'm also seeing some liver issues, pancreas issues in people of Calcutta. So a lot of times fatty liver is seen. And many of the time, pancreatitis, acute and chronic pancreatitis is often seen.
Okay. So this fatty liver and pancreatitis issues, do you think it is related to the oily or fried foods what normally Bengalis are very much eager to take and take?
Yeah.
Or any spicy food? Are those issues related to this?
Yeah. The spicy food issue will be leading to a lot of indigestion in the form of bloating, burning of the tummy, vomiting sensation and vomiting itself. Whereas high oily food will lead to fatty liver. So the fatty liver will cause liver cell abnormality that can in the future lead to cirrhosis of the liver. And with regards to pancreatitis, it is mainly because of excess alcohol consumption, and sometimes without any reason people get pancreatitis, that is called idiopathic pancreatitis.
Okay, doctor. So another thing I want to ask you, here in Kolkata, if you visit any medical shop, if you ask them that what kind of medicines you sell the most, it is identified that antacids.
Correct.
Very frequently, people of Kolkata and other part of West Bengal, they take antacids.
Correct.
Do you have any advice to them?
Yeah. So not only in Calcutta, across the world, if you look at one single medication which is sold across all the medical shops is PPIs, proton pump inhibitor. In common terms, it is antacid. Now, my advice is you can take PPI from medical shops on odd occasions, but please do not, if you were to take medication on a regular basis, please consult your nearest doctor immediately, so that the doctor can decide how often you can take the medication, whether you can stop the medication for a while, restart it, or reduce the dose or stop it completely. Otherwise, what happens is, once you take it on a long-term basis, it is very difficult to stop the medication because body gets used to it, and once you stop it, that will lead to hyperacidity. The acid will get rebound phenomena. So it is very difficult to stop the medication after a couple of years or so.
Okay, doctor. Any issues related to the food habits, means this gap of taking food or taking too much food, which is leading to obesity and other kind of gastrological issues. Do you have any kind of advice for the youngsters, means teenagers, who are very much ready to take junk foods? They take often.
Yeah.
So what kind of advice you will give to them and parents so that they can control it?
Sure. There are two types when it comes to eating habits. One is the quality of the food, next is the regularity of the timing of the food. So as you rightly said, a lot of youngsters will be having irregular diet. They'll be taking late night food and late breakfast, missing breakfast because of busy schedule, missing lunch. So all this comes under regularity or with regards to timing of the food. So my advice is to stick to regular timings, such as not missing any breakfast, take breakfast on regular basis, take lunch on time, take dinner on time, and then after dinner give a gap of 2 hours before going to bed. With regards to the quality of the food, and quite often a lot of street food is being consumed, which can lead to food poisoning, which can lead to fatty livers because of the quality of the oil they use, and sometimes the food contamination lead to gastroenteritis, diarrhea, vomiting, and all these issues. Apart from this, if you're not consuming good quality of food, that can lead to obesity and fatty liver, diabetes, hypercholesterolemia, and also high blood pressure sometimes. So by sticking to food on a regular timings, along with the quality food, consume more of vegetables, consume more of food, consume more of fruit, vegetables, and plenty of water in the food. This will improve the quality of the food and improve the digestive process, and thereby we can prevent obesity and obesity related complications.
Doctor, among the Bengalis, normally Bengalis are very much love to take rice.
Correct.
So, and nowadays it has been a trend that avoid rice, don't take rice, instead of that you eat oats and other kind of things. So do you have any specific advice to the Bengalis regarding the rice eating habits?
Yeah. So the more amount of rice we take, the glycemic index is very high. That means it's more of carbohydrate diet. So the carbohydrate diet, if you're taking in excess, that can lead to weight gain, a bit of obesity and other things. Whereas if you take other food items like oats and other things, you got less glycemic index, less chance of sugar fluctuations, and it can become a healthy habit. Along with that, also consume more of vegetables, kind of high fiber diet. This will improve the glycemic index of the food quality we are taking.
Okay, doctor, what kind of oils are very healthy and should be taken, and what kind of oils should be avoided to avoid the gastrological issues?
Most of the time nowadays we are all of us consuming polyunsaturated oils and like refined oils and all, which are good for heart and good for digestive tract. And only the consuming poor quality of oils which are used for making street food and all can be harmful sometimes. They can increase the heart risk, heart disease risk, they can increase obesity, and lots of sometimes the cancer risks are also higher.
Okay. Doctor, regarding the spices, do you have any specific advices regarding that what spices should be taken for the healthy living and what kind of spices should be avoided?
With regards to spices, not one size fits all, but in general, the amount of spicy food has to be consumed in a little lesser quantity. But we don't need to avoid completely spice. You say somebody might be tolerating spice very well, somebody may not tolerate spice at all. So it depends on the body's response to the spicy food. But in general, stick to lesser spicy diet so that the gastric irritation will be lesser and the gastric related complication will be lesser.
Okay, doctor, I will like to ask you one question regarding one specific spice which we normally use, that is turmeric, haldi. So, what will be your advice regarding taking the haldi, turmeric in the food or in other forms?
Turmeric has got excellent properties, excellent anti-inflammatory properties. And in fact, nowadays the commercial tablets are also coming with turmeric. And so turmeric I don't have any objection in taking. So people can take it, and that has got its own limiting factor. For example, one cannot consume more turmeric. It will lead to bad taste, intolerant irritation of the mouth. So that has got its own limitation. So people can't consume too much of turmeric. But whatever the limitation they are consuming the turmeric, usually that is supposed to be healthy.
Okay. Doctor, another thing, the water drinking habits. So the amount of water and what should be the interval and how the water should be taken, empty stomach or after food or before food. If you give some guidance to this thing.
Yeah. The amount of water is more important than timing or the regularity. So the water has to be taken at least 2 to 3 liters minimum per day, and at regular intervals, irrespective of whether taking before food or after food or whatever. We have to take on a regular interval so that the metabolism requires water, body's metabolism. And in fact, one of the important features or important requirements for weight loss is adequate water intake, which we don't know. Because if you consume adequate water, that will help in dissolving fatty tissue, and the obesity will be lesser. People lose weight along with other parameters. And somebody having high metabolic rate, for example, people who are athletes who are consuming more amount of calories, they have to take even more amount of water to flush their kidneys, flush their muscles. So they need more amount of water.
Okay. Thank you, doctor, for your very informative advices.